Hello, everyone. Thank you for having me here today. My name is Jen Bell. I am a licensed massage therapist based out of North Carolina, and I am also a certified lymphatic therapist. The topic I'm presenting to you today is central lymphatics and how you, as a massage therapist, could potentially help your clients. So, many of you may actually be trained in lymphatic therapies, the manual lymph drainage, and you may be well aware of helping with techniques for the extremities. And so you'll see here highlighted the head, the arms, and the neck. And what I want to bring to your attention is that this region or these regions produce 15 to 20% of the lymph in the body. We're moving to the trunk, which consists of the thoracic cavity, the abdominal cavity, and the pelvic region, produces 80 to 85% of the lymph in the body, which is a pretty big ratio in terms of overall lymph production. And in a lot of training these days, they won't necessarily have appropriate techniques to help fluid flow within these regions. There are some institutions that will teach deeper manual techniques to get the lymphatic fluid moving in these regions to help the flow, but not all of them necessarily do that, and not all agree on what those techniques should be. And that's not really a discussion for here, but what really is just understanding the central lymphatics and that there could be a central lymphatic issue with the people you see on your table. So this animation slide here provided by Dr. Max Itkin kind of covers what is central lymphatics. And for the purpose of this, we're focusing on the organs that are a part of this system. So you will see here in the animation the flow from the organs, and you will note there are some that are missing. The kidneys are not represented, the small intestines, the spleen, the stomach, and some of the pelvic organs are not indicated here, but it's really about understanding the flow from the pelvis, the legs pelvis, into that lower abdominal region, into the cisterna chyli, which is the largest lymph node in the abdominal cavity, up into the thoracic duct, and then the thoracic cavity organs, which drain directly into the thoracic duct. Here is a list. It's a very small list. It does not encompass the entirety of the functions of the central lymphatic system. I won't read through these. You can read through those, but have an understanding of there's really kind of three main functions that the lymphatic system is known for, and that's transportation, immune fighting, and really the waste removal. So those three are really kind of what current research indicates today is their function of transportation of large molecules, fat-soluble molecules, and other large molecules that cannot automatically be picked up into the blood system. Then you also have waste removal from the interstitium and kind of the degradation of molecules and proteins and things in the tissues that the lymphatic system will pick up and clear out. So some of the big hitters here to think about is the regulation of tissue fluid. And so it's not just lymphatic fluid, but it's overall tissue fluid. So fluid from the arterial flow, the venous flow, the cerebral spinal fluid flow, interstitial flow, and lymphatic flow. So it's really whatever's happening in your aquarium that the lymphatic system is moving those fluids. I also want to focus on the development. You'll see that in here is the development and transport of the fat-soluble vitamins A, D, E, and K. So development piece of that is an interesting thing to think about, that the lymphatic system could potentially be a key role in development of certain things within the body. So also bringing your attention to key lymphatic system drains, lung lymphatic draining. So just really gaining an awareness around organs within the body and having their own lymphatic draining pathways. So again, this is just a scratch on the surface of the functions of the central lymphatic system. So how did I get here? How did I get into central lymphatics? And I landed in this space because of my husband, who had a procedure for acid reflux 19 years ago, where a 2-part liquid plastic was injected into the sphincter, cardiac sphincter, and at the end of the esophagus to keep acid reflux down out of the esophagus. And they over-injected the plastic and directly into the thoracic duct. And you can see that plastic here in the thoracic duct. And then you see how the cisterna chyli glows as well. And essentially after 3 minutes, any liquid portion of that plastic became solid like a Welch's grape bottle. And so not only did it end up in the main central lymphatics here, but also within the lymphatics of all of his organs. So here is a side view of that CT scan. So you can see, and the goal of this image here is to show you how deep this really is and how just anterior of the spinal column it is. And so thinking of techniques that you would need to use in the abdominal and the thoracic cavity to really get this flow of central lymphatics moving. And so it's just being mindful of what could you do to really get into a space that has a lot of sensitive and vital organs in the abdominal cavity as well as the thoracic cavity, and thinking of bony structures and things like that. So while this is not really about techniques for the presentation today, it really is just trying to cultivate your thoughtfulness and how would you help central lymphatic flow and getting an understanding that you need to go deep. This is just a 3D rendering of that. The white here is the plastic, so you can see it within the thoracic duct and how even in and around here into the intestines and smaller portions, kind of the outline here behind the kidneys, so you can see where the plastic in the heart. And so yes, while it's blocking the lymphatics of the heart, the lung, the liver, the spleen, the intestines, he is not the only one who has a central lymphatic dysfunction, right? So he may be a unicorn in how his symptoms developed with the lymphatic dysfunction in the central lymphatics, but he's nowhere unique in having a dysfunction here. And so I just take the cancer population as just one segment of the population to look at. And so how many are potentially affected from cancer treatments and surgeries alone? And so this data was provided by the National Cancer Center, and in the red is diagnosed. The numbers diagnosed with these various cancers that run across the bottom of the graph, and then potentially how many of those ended up with a central lymphatic dysfunction. And so patients diagnosed with organ cancers from 2021, you could say that 30% of those may have developed damage to their central lymphatics, right? So if we take 30% of this overall population, then that's over 316,000 annually. And that's a lot. And when you think in our 2024 timeframe that cancers are spiking and on the rise and younger populations are included, then how many of those could potentially also have impairments to their central lymphatic system because of cancer treatments? And I'm not even including the population that would have any types of just regular surgeries within the thoracic, abdominal, and pelvic region, like gallbladder surgery or, things of that nature that, we don't think of, but they should be encompassed as well. I've just highlighted cancer treatments and surgeries just because that's what we're discussing a lot these days. So how do I approach appointments, lymphatic appointments with my clients? And so I start off with a complete health history review. Many of them are not diagnosed lymphatic clients. They assume they have a functioning lymphatic system. Many do not know if they have a lymphatic system. And so it's an education as well during that time frame. But really what I start off with is a health history review. And the question you may have is, well, why are you doing like a whole health history review? And it's really for me to see how many hits the system has taken in their lifetime. And as you can see here, there's a list. It's not fully encompassing, but in terms of things that we work through from head to toe on, have you had an impact to this area? Have you had root canals? There are lymphatic pathways to all of the teeth. So GI issues, especially if somebody has GI issues, if they have a metabolic syndrome, while I can't diagnose that they would have a thoracic duct issue or a lymphatic issue in the central region, I move forward with just being thoughtful of let's clear stuff. Let's clear the pathway for things. And so parasitic infections, weight loss issues, and also I'm looking for the anomalies, things that may have been titled as unique to them, but not really unique in the sense that, it's happening in their body, it's impacting, and it's something that curious why it popped up. And so I want this session to kind of put them back into their body as well and gain an awareness of how much has occurred to their system. Because most of my clients that come for this are in a chronic state. They have chronic health issues that either surgeries or pharmacological interventions have not been able to resolve. So they land on my table for what can they do for their own health. So, but I want them to get a bigger picture and not discount things that pop up, even historically, today, or in the future, and not consider that it's impacting their lymphatic system. So I definitely want them to consider that. So the second step is assessment of the major lymph node regions, really the medium fluid pipeways, as I like to call them. And I use the assessment that Dr. Perry Nicholson, some of you may know him, I use his lymphatic assessment list. It's just going in and palpating regions, asking the clients if it's sensitive, if it feels uncomfortable, or if it's painful in those regions. I find a lot of people are actually very painful in and around the Chapman points that are located in between each rib as the ribs come in and meet the sternum. Oftentimes those are very tender on people. So it's neurolymphoid tissue, and it gives them awareness. Nobody's ever been in their armpit. Rarely has anybody been in their belly, and definitely not into the Chapman points along the sternum in between the ribs. So it kind of brings them in to a self-awareness as well. And then once I've gone through that assessment, I do a major clearing of what Dr. Perry Nicholson dubs as the big six. So that's starting with the collarbones, the cervical lymph nodes, nodes in the chest, work in the abdomen, the inguinal nodes at the hip, or really where the leg meets the groin, and then behind the knees. And so we go through those, and then when they come back, we do a mix of some other manual techniques, whether it's brain draining with Dr. Perrin and his Perrin method, or other fluid flow techniques. So we'll work from there. But this session is heavily on lymphatic education, lymphatic awareness, things that they can do for themselves. And it's just really an opportunity for them to get into their body and to know that they potentially have the ability to do things for themselves. So here's Dr. Perry Nicholson. Stop Chasing Pain is his website. I am not a paid sponsor or supporter of him. I just really love and am influenced by his work. And I say that because he himself has experienced a huge lymphatic crisis, a huge health issue that was chronic, and allopathic medicine couldn't help him. And this is a quote of his on this slide. He had to figure it out himself and pulls in a lot of traditional osteopathic techniques, Eastern medicine techniques, and so I really like his overall approach to dealing with lymphatics. Also, Dr. Perrin, Raymond Perrin, he is an osteopath from the UK. He focuses a lot on clearing the cerebrospinal fluid, kind of bathing up and through the brain into the lymphatics, which are the lymphatics of the brain, and clearing the toxins out in the brain pathways. So I'm trained in this technique as Megan is, and so this is a great complement to lymphatic work. It involves central lymphatics because you're dealing with the lymphatics of the thoracic cavity. So again, while ultimately the flow is in the head, you're having to navigate the central lymphatics to help assist with brain drainage. So just some of my final thoughts here is, most of the people who land on my table are not diagnosed with a lymphatic dysfunction. They may never be diagnosed with lymphatic dysfunction. I see more of these people than I do people that are diagnosed with lymphedema or edema. And so, if you do see some of these people, you will not know if their central lymphatics is working. You won't know if it's well or unwell. And so if they have a chronic issue, or multiple chronic health issues, that's why I'm like, how much has the system taken a hit? So an education of the lymphatics for them. So it really is important for them to understand what's going on in their own body. I want them to be curious, and I want you to be curious. I want you to be open-minded, and I want them to be open-minded about what's happening in their body, thinking outside of the box on how to help with chronic issues and methods to approach clearing central lymphatics. You have to have great listening skills, both you and the client, and then really cultivating a client and therapist partnership and techniques that they can walk away with to be able to do at home, that they don't have to come see you every week. And in this day and age where things are costly, things that they can do themselves to help clear their system and keep things going. So yeah, so it's a win-win. So thank you for your time today. Thank you for your interest in central lymphatics.